Hello and welcome to Kidney Plugged In. The Kidney Foundation of Canada has a national research fund which provides research grants for the advancement of current knowledge in studies that include kidney health, kidney disease, organ donation, and transplantation. Dr. Peter Nickerson is the co-chair of the Kidney Foundation's Research Council, which governs the research granting process. And providing grants for research projects is just part of the exciting work that we do here at the Kidney Foundation to improve the lives of persons living with kidney disease as well as kidney transplant recipients. Dr. Nickerson joins us today via Zoom from Winnipeg to explain how the Kidney Foundation's research funding and grant process works. So stay with us because Dr. Nickerson joins us next, right here on Kidney Plugged In.
The Kidney Foundation of Canada has a national research fund that encourages research that advances current knowledge pertaining to the kidney, disease of the kidney, organ donation, and transplantation. We provide kidney health research grants for researchers working across all 4 themes of research, including biomedical, clinical, health services, and social, cultural, environmental, and population health research. Funding is also provided for allied health care professionals through research grants, fellowships, and scholarships. Finally, the collaborative Crescent Program supports capacity building for young researchers that are just starting off in their career. Joining us in just a moment via Zoom and all the way from Winnipeg is Dr. Peter Nickerson, Chair of the Kidney Foundation Research Council. He's going to tell us a little bit more about our research funding process. So stay with us because our interview with Dr. Nickerson is coming up next right here on Plugged In. So we are so pleased to have Dr. Nickerson with us here today, all the way from Winnipeg. Hello, Dr. Nickerson.
Hi, Ramya. Good to be here today.
Excellent. Thank you so much. So let's get started. I think my first question is, can you tell us a little bit more about the Kidney Health Research Grant Competition?
Sure. It's a competition that the Kidney Foundation has been putting on for years now. And it's probably seen by the kidney community as one of the vital mechanisms of actually advancing kidney health research in Canada. These are grants that are provided to researchers to support them in terms of their operating dollars to take an idea from its germination all the way through to its fruition and ultimately see advancing care for patients with kidney disease.
What would some of those operating costs be?
Yeah, so this could be for your research personnel in the lab, or it might be a study nurse that's working for you. It's for the technical costs of supplies. It might also be for developing or getting access to various services like data analysis, this sort of thing. So it's really the operating costs of running the project.
All those little things that we don't think about.
Exactly.
What does the application process look like, and how are the award recipients decided?
Yeah, so another great question. So this is a very rigorous process. It goes through a thing called peer review, which are other researchers and scientists in Canada who have knowledge in the area of kidney health or kidney research. And essentially an individual who's a scientist or a clinician or even an allied health professional, they'll have an idea, a hypothesis of what they think is true, and then they'll put down on paper in their application exactly how they're going to prove or disprove this idea. And many times these ideas need to have some preliminary data. They need to, what's the evidence to support this? What do we know from the prior evidence that's out in the literature? So the researcher will bring all these together and they'll write it up in their application. And then that application goes to the committee that reviews through this peer review. A couple of individuals will go in detail into the proposal. And they'll test and figure out whether they think that the person has made in their proposal sufficient evidence to support why they think what is true is going to be true. And they'll look at the planned experiments that the person is proposing so that at the end of the point, if they feel that this is a high likelihood of success, it's addressing a very important question to the kidney community, to the patients, then they'll support that to go forward for consideration of funding.
That does sound like a very complicated process.
It's complicated, but I think what it does is it puts real rigor into the process, so that when somebody gets money from the Kidney Foundation actually knows that person has a high likelihood of success with their area of research, which I think is really important to the donors and the people that are supporting the Kidney Foundation, because they want projects that they think are going to go forward. So our goal as the review committee is to make sure that there's enough thought and justification so that we actually see the dollars spent in a very well and wise manner.
Dr. Nickerson, this has been wonderful so far. I can't wait to hear more. Stay with us. You don't want to miss what's next.
We are so pleased to have joining us today one of the first-year participants of the Kidney March, David Bancroft. David, welcome to Plugged In.
Thank you. It's a pleasure to be here.
It's great to see you actually in a different setting, because usually I see you in the office. You are the data entry and administrative assistant here at the BC Yukon Branch.
Yes, indeed. I've been here at the Kidney Foundation for about 2.5 years, and it's a very enjoyable job.
And what viewers might not know is you're kind of the guy behind the kidney car program. All of that data that comes on in from all those cars that are donated, you're the one that makes sense of it all.
Indeed. I do a lot of the data entry and the tax receipting.
And this year, you added another title.
It's my very first Kidney March, and it was a wonderful cause. I wanted to challenge myself physically and raise some money for this issue. I also wanted to be part of this terrific community of the Kidney March community. This is how I start my day. Kidney car on one side, Kidney March on the other. I signed up towards the end of last year. This was back before COVID, so it was going to look like a very different march at the time. 3-day, 100-kilometer walk from Kananaskis to Calgary. Everyone going together, camping out at night. And so because of COVID, of course, we were not able to march all together, congregating in one area. Everyone just marched in their own separate communities. Thankfully, we had a little bit more than just the original 3 days to do it. Since we were all on our own, we basically got to spread it out over a month, from mid-August to mid-September. For the most part, over the previous month, everyone was setting their own schedule. But over the final 3 days, we all across the country walked at least 10 kilometers per day. And there was also an online opening ceremony, an online closing ceremony.
Welcome, Kidney Marchers, crew, family, friends, to the closing ceremony for Kidney March 2020.
We tried to pull together a community as much as possible, albeit virtually. I hiked up in the North Shore Mountains, north of Vancouver, and I went on a lot of terrific hikes. I definitely went according to the weather. Thankfully, it being summer, the weather was very cooperative, and I just researched some trails that I wanted to do, some old favorites as well as some new ones, and got out there into the mountains. Some days I just did 7 or 9 kilometers. Other days it was almost 30. But
I love how you're categorizing this. Just 7 or 9 kilometers, and some days 30.
Some definite highlights for me were hiking to Crown Mountain and Coliseum Mountain. Those are some of the highest mountains in the North Shore, and the views were absolutely spectacular. It felt very remote and sort of magical. It's pretty much an all-day endeavor. I was hiking during all parts of the day. I suppose morning feels kind of nice and peaceful, and the air is a little bit crisp, which is good. But yeah, I continue hiking through the afternoon and evening.
Being, an avid hiker, you might have a couple of tips out there for our viewers.
Well, one thing I can't recommend too much is the anti-blister socks. These are special double-layered socks which help prevent blisters. They're very important. In fact, a longtime kidney marcher, Kate, was the one who first recommended those to me. As for hiking, a very useful tip is to hike slowly enough that you don't need to take too many breaks. That way, on balance, you can keep your speed up without overburdening yourself.
You were part of the Because You Can team here in BC. Tell us about the title, Because You Can.
Well, that's related to the BC Yukon team, because BC Yukon Yukon.
A play on words.
Exactly.
So tell us a little bit about your personal fundraising page.
Sure. Well, fundraising is sort of outside of my comfort zone. It's not something I do a lot of, but for a good cause, I was happy to pitch in. Everyone had a minimum target of $2,200. And so far I have raised $2,339 and counting. It was all online. I reached out to friends and family.
And I saw on the Kidney March website, it's already the countdown for next year for 2021. That will be the 12th year anniversary of this phenomenal, epic event.
Next year, I hope things will be looking better. I was looking forward to getting over to Alberta and marching together with several hundred other participants. It didn't quite work out that way, but it was still a great experience.
What would you say to others thinking about maybe I'll do that next year?
Well, I felt it was a great personal challenge as well as an excellent community building exercise, all geared towards a wonderful cause. So it's very much worth it.
Well, as I said, a kidney hero, along with all the participants at the Kidney March. Thank you so much for participating. Thank you for being part of Team Because You Can. Congratulations on your personal achievement, David.
Thank you so much. That's very kind of you.
And thanks for joining us here on Kidney Plugged In.
My pleasure.
Hello everyone, we're back here with Dr. Nickerson. Can you speak to our different research committees that are involved with this process? So we have a Research Council, Kidney Health Scientific Committee, Allied Health Scientific Committee, and the Crescent Committee, the role they play in deciding the grant recipients and what this process looks like.
Sure. So you're right, there's a lot of committees, and what that really speaks to is that this is a large team effort of Canadian scientists and researchers coming together to review all the proposed research that we get every year. Starting with the Crescent Committee, this is a committee that's looking at young up-and-coming stars in the kidney research community. These are generally individuals who have completed their clinical training, and now they're wanting to pursue a research career, which means they're taking 2 to 4 years to get additional training in how to do research. And what the Crescent Committee is doing is reviewing who are, of all the applicants that are coming forward, who are the ones that have the most exciting projects that the Kidney Foundation really wants to get behind and see this person advance their training in this phase of their career. And then the Crescent Committee also looks at the people who have finished their research training and now are coming into early career investigators. And the Crescent program supports them not just in their training phase, but now coming into the next phase when they're going to be the junior faculty. And they're also looking at making sure that that science is going forward. So Crescent Committee plays a very important role in really looking at the next generation of scientists in kidney health research in Canada, and a really important committee. The Allied Health Scientific Committee, this is a committee that's really looking at individuals outside of medicine. So this would be, for example, nurses, psychologists, social workers, It could be technicians, biomedical engineers, dietitians, physiotherapists, pharmacists, occupational therapists, the rest of the team that works with physicians really that are advancing research. And many times the allied health research community has excellent questions to be asked that are really important for patients. You know, it's not just about what's the latest new drug that's going to be treating somebody, but it's really looking at the person as a whole and looking at that person in a holistic way. Many of these other allied health professionals have really good ideas that are addressing patient outcomes directly. So this is a really important area of research, and it's a very important area of research for our patients. And they're the ones that many times tell us what are the key questions to go forward. So this committee is looking at proposals that's coming from that allied health community. And they're trying to find what are the right questions that are really pertinent to patients. And in addressing these questions, how is it going to advance patient care? So again, that's at that committee. And then the Kidney Health Scientific Committee, that's one of our largest committees. They get about 60 to 70 grant applications a year. This is by the PhD scientists or the clinician scientists that are in Canada doing kidney research. And these are the proposals that they all go through rigorous peer review, but this is probably one of the biggest committees. Instead of taking a half a day to go through the applications that come to some of the other committees, this is generally a 2-3 day process.
So what is the peer review process, and why is that essential to our granting program?
So we have a fairly large committee. It's usually about 40 or 50 people. They're reviewing, not only are they reviewing probably about 7 or 8 applications themselves, but they're hearing all the other people and their reviews, and they're also voting towards what they think is the most important research that has been well justified by the scientists coming forward. So that's the Kidney Health Scientific Committee. All these 3 committees, they're the ones that are reviewing the science that's coming forward from either the medical scientific community, the allied health community, or from the up-and-coming stars in research in Canada. And they're the ones making recommendations ultimately to the Research Council. And the Research Council is comprised of the chairs of these various committees, plus public members. And the public co-chair of the Research Council brings to the table that they're representing the interests of the kidney community at large, representing both the patients and their families to make sure that we're on track, right? So we might think that we're on track, but we need that gut check and the validation from the public, because ultimately that's what we're here for, is the patient care and advancing ultimately outcomes for our patients. And so we want to make sure that our priorities are aligned with what the patients are telling us are the important priorities. So that was a long-winded explanation, but these committees really are the essence of where the Kidney Foundation invests, how they decide to invest, and making sure it's accountable ultimately to the donors and to the patients.
And truly a collaborative effort from all perspectives, which is very good to hear.
Absolutely, and in fact, all these committees, not only do they review the science, but they actually provide critique. So even when a application is awarded, the person gets feedback on their grants and they say, hey, why don't you tweak it this way? And it will actually be a better grant and a better proposal. And so the feedback that they get really from the community at large is advancing the science as to make it as good as it can be.
Very interesting. Thank you for that explanation. More coming up in just a moment, so stay with us.
Can you imagine losing most of something without realizing it? Over time, kidney disease can destroy up to 80% of kidney function before you notice any symptoms. Talk to your family doctor to see if you're at risk and need to be screened. It could save your life.
And we're back now for more with our interview with Dr. Nickerson. So let's talk about the Crescent Program a little bit more. It involves a number of awards, actually, that support individuals in various stages of their career. So what do you see as some of the innovative highlights of this program to support young researchers beginning in their career?
Sure. So, we talked a little bit earlier about the idea that the Crescent Program is both taking people who are finishing their clinical training and now they're beginning to learn how to be a researcher. And so during that phase of their career, what's really important is they actually not only do their research project, but they actually get trained in how to write a grant, how to write a paper, how to put a budget together, how to run a laboratory, how to do peer review well. So all the tools that you need to be a good researcher, the Kidney Foundation, through the Crescent Program, which is a partnership with the Canadian Institute for Health Research, really spends time training you in the key things that you would need to learn to be a good researcher. And that, again, is invaluable. Without the Crescent Program, what used to happen is you would get your research funding to do salary support for you as a trainee. You would do your research, but then it was hoped that you would learn these other, what you would call soft skills along the way. And for many people, that didn't happen. And I think the aha moment came several years ago when the Kidney Foundation said, no, we've got to stop. We've got to make sure that we're training these individuals in the skill sets that they need. And what we've seen since that time is that the people that complete the Crescent Program not only are very competitive for Kidney Foundation grants, but they're very competitive for national grants through the federal government, like CIHR or NSERC-based grants. So it really is a key element. And then the second phase is this phase of, you've been trained how to be a researcher. Now you're going to be junior faculty. And, coming on and setting up your own lab while you've been told what to do and how to do it through the Crescent Training Program. In this phase, it really is bringing it home. And this really provides a community of junior faculty from across the country that come together regularly, and they learn from one another what's working, what's not working. And I think it really has, what we've seen is this kind of concept of a collaborative community of researchers. These are all people who have grown up together, if you will, at the same time, either through their training phase or junior faculty phase. And this has created such a close network in the country that now these people are doing research collaboratively together. And so they actually start forming networks across the country. And that actually has huge power, because what I can do in my local site, for example, in Winnipeg, if I really want to move this idea forward, I actually need a collaboration with 4 or 5 other centers in the country who want to do the same kind of research. Well, if you have that network established through the Crescent Program, it's so much easier to pick up the phone and say, hey, let's do this project together. And conversely, the other person calls you and says, hey, I really need you to enroll your patients into my research program. Can you do that for me, right? So now you've built up this network that works collaboratively together. And I think that's probably, again, one of the big payoffs that the Crescent Program has had.
More coming up with Dr. Nickerson in just a moment, so stay with us.
Let's see, so kidney is a... These are my grandpa's kidney stones. They're very precious. Kidney is a bone in your back that helps you turn. I don't know, to be honest.
They don't know kidneys are vital, do you? Get the facts at kidney.ca.
And we're back here with Dr. Nickerson. So Dr. Nickerson, I'd like to talk a little bit more about our Allied Health Research Grant Funding Program. Can you explain what an allied health research field would be?
Sure. So allied health professionals, these are individuals like nurses, psychologists, social workers, technicians, biomedical engineers, dietitians, physiotherapists, pharmacists, occupational therapists. So really it's the whole team that looks after an individual. So it's not just a physician or a basic scientist doing research on kidney disease. It's actually a whole team of individuals that are potentially involved in that research. And many times the allied health researchers are asking questions that are really pertinent to the patient. In fact, many times they'll have groups that they'll bring together of patients and say, hey, what are the important questions for you? What are the things that if we could do some research on, that this would actually improve your daily living, your ability to participate in various aspects of life. And so the Allied Health is really patient-focused in their research. And so we have different types of grant funding. We have a doctoral fellowship. So these are individuals who have completed their clinical training. So a nurse will have completed her RN, her BN. And now they're interested in pursuing a career in research. They don't just want to go and work clinically, like a physician who wants to do research. A nurse who wants to do research might want to go on and do her doctoral studies, her PhD. So then she would apply to the Allied Health Kidney Doctoral Fellowship, where this would support her salary while she's doing her doctoral studies and training, which generally is both courses, writing a thesis, and conducting research related to obviously kidney health. And then we have the Allied Health Kidney Research Grants. And so this type of an individual, they finish their training, now they are on faculty and they're doing research. They also need a source of funding to do their research. Again, supporting either staff or supplies or services like data analysis. So we have an Allied Health Kidney Research Grant, which would give up to 2 years of $60,000 a year. So really substantial amount of money to allow that individual to conduct allied health research in kidney health.
I love that patient-centered focus on research that you touched on there too.
Yeah, no, I think we as a community as a whole really have changed our focus in the last decade or more now to be much more patient-focused, realizing that the patients really, have critical issues that for them they want answers to. And if we listen to them, many times we can be on track. And in fact, I think the patients feel that their lives are getting better through that types of research.
So Dr. Nickerson, I want to thank you so much for being here with us today.
Well, thank you, and it's been a pleasure to talk about the programs at the Kidney Foundation, the exciting things that you've been investing in and will continue to invest in. And I look forward to the opportunity when we can all get together again and celebrate some of the things that are going on inside the kidney health research community.
Dr. Nickerson will join us again on the next episode of Kidney Plugged In, so we hope that you will join us too.